For years, you've been told to watch your carbs, monitor your blood sugar, and diligently take your medication. You've done everything right. You've followed the guidelines, made the sacrifices, and shown incredible discipline. Yet, despite your best efforts, you still feel exhausted. Your hands tingle, your memory slips, or your vision seems to be getting worse. Perhaps you're constantly battling brain fog or struggling with inexplicable muscle weakness. It feels like a relentless uphill battle, and you might even start to wonder if you're just destined to feel this way with diabetes. What if I told you there's a hidden culprit behind these persistent and often debilitating symptoms? A silent robber that's depleting your body of vital nutrients, often caused by the very medication meant to help you? It's a reality many healthcare providers don't widely discuss. A crucial piece of the diabetes puzzle that's frequently overlooked. This isn't about blaming anyone. It's about uncovering a profound truth that could unlock a new level of health and vitality for you. In this video, we're going to expose these silent nutrient thieves, reveal exactly which medications are doing it, and give you a powerful, actionable plan to reclaim your energy, protect your organs, and truly thrive with diabetes. This isn't just about managing symptoms. It's about getting to the root cause of why you might not be feeling your best, even when your blood sugar numbers look good. Get ready to have your eyes opened and your health empowered. Hi, I'm Dr. Michael Bennett, a nutritionist with over 20 years of experience, and my mission is to uncover the truths about health that often get overlooked, providing you with actionable insights to live a healthier, fuller life. Today, we're diving deep into a critical topic for anyone managing diabetes, whether type 1 or type 2, nutrient deficiencies. This isn't a minor issue. It's a foundational challenge that can dramatically impact your long-term health and quality of life. Most conventional doctors, quite rightly, focus intensely on blood sugar control and medication management, which are undeniably crucial for preventing acute complications. However, what's often missed is the intricate dance happening beneath the surface, how chronic high blood sugar, persistent inflammation, surprisingly, certain diabetes medications, especially metformin, silently drain your body of the essential vitamins and minerals it desperately needs. This isn't just a hypothetical concern. It's a well-documented physiological reality. Imagine building a house. You might have the perfect blueprint and strong walls, but if the very foundation is crumbling due to unseen forces, the whole structure is at risk. That's what happens when vital nutrients are silently depleted. If you're ready to stop this silent drain and supercharge your health, hit that like button right now and subscribe to join our community for more life-changing health insights that empower you to take control. Let's start building a stronger foundation for your health, starting today. The unseen threat. Why diabetics are vulnerable. It's not just your diet or what you might assume are the obvious factors. There are deeper, insidious reasons why diabetics are often living in a chronic nutrient deficit, even if they eat what they consider a healthy diet. Understanding these mechanisms is the first step towards truly addressing the problem. First, persistent high blood sugar itself acts as a diuretic, causing increased excretion of water-soluble vitamins and minerals through your kidneys. It's like having a leaky bucket. No matter how much you pour in, some vital contents are constantly seeping out. Second, chronic inflammation, a hallmark of diabetes, significantly increases your body's demand for certain antioxidants and anti-inflammatory nutrients, creating a higher metabolic need that often isn't met. Third, insulin resistance, a core component of type 2 diabetes, can impair the absorption and utilization of certain nutrients at a cellular level, making it harder for your body to fully benefit from the food you eat. And let's not forget the common gut issues many diabetics face, like dysbiosis or poor fat absorption, which directly hinder nutrient uptake. But here's the bombshell, and it's one you absolutely need to know. If you're on metformin, the most widely prescribed medication for type 2 diabetes, listen up very carefully. This drug, while undeniably effective for blood sugar control and a lifesaver for many, is a known silent robber of critical B vitamins and iron. It's not a side effect listed prominently on the pamphlet, but it's a clinically recognized interaction. Metformin works by reducing glucose production in the liver and improving insulin sensitivity, but it also interferes with the absorption of certain nutrients in the small intestine, specifically B12 and folate, and can impact iron levels. This isn't a minor inconvenience. It's a profound impact on your body's most fundamental processes. The big four medications are robbing you of. Now, let's expose the specific nutrients most at risk, the devastating symptoms their depletion can cause, and most importantly, how you can reclaim them. This is where the rubber meets the road, providing you with targeted knowledge. Number 1. Vitamin B12, the nerve protector and energy dynamo. Why it's lost. Vitamin B12, also known as cobalamin, is particularly vulnerable to depletion in diabetics, especially those on metformin. Metformin interferes with the absorption of B12 in the small intestine by affecting a protein called intrinsic factor, which is crucial for B12 uptake. Chronic inflammation and general gut issues common in diabetes further compound this problem, making it harder to absorb this vital nutrient. Symptoms: imagine Sarah, a 55-year-old on metformin for years. Despite stable blood sugar, she found herself increasingly fatigued, experiencing tingling and numbness in her feet, a symptom often attributed solely to nerve damage from diabetes itself, struggling with memory lapses, and battling persistent brain fog and even bouts of depression. These are classic signs of B12 deficiency. Other symptoms include poor balance, muscle weakness, and a general lack of energy that no amount of sleep seems to fix. Cellular role. B12 is absolutely essential for nerve health, specifically in maintaining the myelin sheath that insulates your nerves, ensuring proper signal transmission. It plays a critical role in DNA synthesis, red blood cell production, and the intricate energy production pathways within your mitochondria, the powerhouses of your cells. Without adequate B12, your body simply cannot perform these fundamental tasks efficiently. Best bioavailable sources: food and supplement. Crucially, vitamin B12 is only reliably found in animal products. Top food sources include liver, especially beef liver, clams, sardines, salmon, and red meat. While eggs contain B12, it's less bioavailable. For supplementation, prioritize methylcobalamin or adenosylcobalamin, which are the active forms your body can readily use. Avoid cyanocobalamin if possible, as it requires your body to convert it and is less effective for many. What to avoid? Excessive alcohol consumption, chronic use of proton pump inhibitors, PPIs or antacids, and a diet high in processed foods can further impair B12 absorption and utilization. Number 2. Folate, vitamin B9, the cellular repair specialist. Why it's lost. Folate, or vitamin B9, is another critical nutrient that suffers at the hands of metformin. The drug can inhibit the enzyme that converts dietary folate into its active form, making it less usable by the body. Furthermore, a diet high in processed grains, which are often fortified with synthetic folic acid, not natural folate, and a high-sugar diet can deplete true folate stores and contribute to an imbalance. Symptoms: folate deficiency can manifest as persistent fatigue, nerve pain that feels like a burning or shooting sensation, and unexplained mood swings or irritability. It significantly increases homocysteine levels in the blood, a major risk factor for heart disease and stroke, both common complications in diabetics. It can also contribute to a slow decline in kidney function and poor wound healing. Cellular role: folate is paramount for methylation, a vital biochemical process involved in DNA repair and synthesis, detoxification pathways, and the production of neurotransmitters that regulate mood. It's also crucial for the production of healthy red blood cells, preventing certain types of anemia. Best bioavailable sources: food and supplement. Excellent food sources include liver, dark leafy greens like spinach and kale, asparagus, avocado, and lentils. For supplementation, it is absolutely vital to choose methylfolate, specifically L5-MTHF. Many individuals have a genetic variation, MTHFR, that prevents them from efficiently converting synthetic folic acid, the form found in most fortified foods and cheaper supplements, into the active form their body can use. What to avoid? Excessive alcohol, processed grains that lack true folate, and high-sugar diets that increase metabolic demand on folate. 3. Iron, the oxygen carrier and energy generator. Why it's lost. Iron deficiency, leading to anemia, is more common in diabetics than often realized. Metformin can play a role here by impacting gut absorption, and chronic inflammation typical in diabetes can also interfere with iron metabolism, leading to what's called anemia of chronic disease. Gut issues and any occult bleeding from diabetic complications like kidney issues can also contribute. Symptoms. Consider Mark, who despite controlling his blood sugar, felt a bone-deep exhaustion that was relentless. He often felt dizzy, looked pale, had constantly cold hands and feet, experienced hair loss, and sometimes even a rapid heartbeat just from walking up a flight of stairs. He initially dismissed it as just part of diabetes, but it was severe iron deficiency. These are classic symptoms of iron deficiency anemia. Cellular role. Iron is the core component of hemoglobin in your red blood cells, which is responsible for transporting oxygen from your lungs to every single cell in your body. Without sufficient oxygen, your cells can't produce energy efficiently. Iron is also crucial for energy production within the mitochondria and for various enzyme systems vital for overall metabolism. Best bioavailable sources. Food and supplements similar to B12, heme iron, found exclusively in animal sources, is far superior in absorption compared to non-heme iron from plants. Top sources include liver, oysters, sardines, and grass-fed beef. Always pair iron-rich foods or supplements with vitamin C to enhance absorption. For supplementation, iron bisglycinate is generally the most gentle on the stomach and well-absorbed, minimizing common side effects like constipation. What to avoid? Dairy products, excessive coffee or tea due to tannins, and processed grains can inhibit iron absorption. Number 4. Vitamin A, the vision protector and insulin optimizer. Why it's lost? Vitamin A deficiency is surprisingly prevalent in diabetics. High blood sugar can impair the conversion of beta-carotene, the plant form of vitamin A, into its active form, retinol. Furthermore, many diabetics experience issues with fat absorption, and vitamin A is a fat-soluble vitamin, meaning it requires dietary fat for proper absorption. Symptoms. Symptoms can range from dry eyes, night blindness, difficulty seeing in low light, and worsening vision. It also contributes to nerve damage, kidney issues, a compromised immune system, making you more susceptible to infections, persistent skin problems like dry skin or acne, and very slow wound healing, a critical concern for diabetics. Cellular role. Vitamin A is far more than just for vision. It plays a crucial role in gene regulation, influencing cellular growth and differentiation. It is vital for maintaining the health and function of pancreatic beta cells, which produce insulin and play a role in overall insulin sensitivity. It also supports robust immune function and cellular communication. Best bioavailable sources. Food and supplement. The most crucial point here is that retinol, preformed vitamin A, found in animal sources, is the only form your body can directly use. Beta-carotene from plants, like carrots and sweet potatoes, must be converted to retinol, and this conversion is often poor, especially in diabetics and those with gut issues. Top food sources include liver, cod liver oil, egg yolks, and grass-fed butter. For supplementation, look for retinol palmitate derived from fish liver, which is the preformed, active vitamin A. What to avoid? Diets high in processed vegetable oils and high fructose corn syrup can deplete vitamin A stores or interfere with its function. Beyond the big four, other unsung heroes. While those four are critical, there are other unsung heroes your body desperately needs to manage diabetes effectively and optimize your overall health. These nutrients play supporting roles that are just as vital to the larger orchestra of your body's functions. Magnesium, the master mineral. Importance. Magnesium is involved in over 300 enzymatic reactions in your body, making it a true master mineral. For diabetics, it's particularly important because it plays a key role in insulin sensitivity, helping your cells respond better to insulin. It also supports proper nerve function, muscle relaxation, blood pressure regulation, and energy production. Many diabetics are deficient due to increased excretion and poor dietary intake. Sources: abundant in dark leafy greens, nuts, almonds, cashews, seeds, pumpkin, chia, dark chocolate, avocados, and legumes. Supplement form: Magnesium glycinate or citrate are generally well-absorbed and gentle on the digestive system. Vitamin D, the sunshine vitamin and hormone. Importance, often referred to as a hormone rather than just a vitamin. Vitamin D is crucial for immune function, bone health, and plays a significant role in pancreatic beta cell function and insulin secretion. High prevalence of deficiency is observed in diabetics, potentially contributing to disease progression and complications. It helps regulate blood sugar by improving the body's response to insulin and reducing inflammation. Sources: primarily synthesized from sun exposure. Dietary sources include fatty fish like salmon and mackerel and fortified foods. Supplement form: D3 cholecalciferol is the most effective form for supplementation. It's often recommended to take it with vitamin K2 for optimal bone health and calcium regulation. Chromium, the insulin enhancer. Importance: chromium is a trace mineral that enhances the action of insulin, effectively helping insulin do its job better at a cellular level. This means it can help improve glucose uptake by cells, which in turn helps regulate blood sugar levels. While not a cure, it's a valuable support nutrient. Sources: found in smaller amounts in broccoli, grapes, whole grains, and certain meats. Note that absorption from food sources is typically low. Supplement form: chromium picolinate is the most commonly studied and bioavailable supplemental form. So, what have we learned today? Managing diabetes isn't just about diligently monitoring your blood sugar or strictly adhering to medication protocols. It's about addressing the silent nutrient deficiencies that could be silently sabotaging your energy, exacerbating your symptoms, and putting your long-term health at risk, often exacerbated by the very medications you rely on, especially metformin. This knowledge is not meant to scare you, but to empower you. Don't suffer in silence with unexplained fatigue, nerve tingling, memory issues, or vision changes. If you're experiencing these or other persistent symptoms despite controlled blood sugar, you now have the knowledge to demand more from your healthcare. Ask your doctor to have your vitamin A, B9, folate, B12, iron, magnesium, and vitamin D levels thoroughly checked. These are not standard tests for many, but they are absolutely vital for a holistic view of your health. Beyond testing, prioritize nutrient-dense whole foods, especially animal sources for those key vitamins like B12, iron, and preformed vitamin A. These are the powerhouses of nutrient density. Consider targeted, bioavailable supplementation under medical guidance. This is not a substitute for a healthy diet, but a powerful tool to address specific deficiencies when diet alone isn't enough or when medication is causing depletion. This information empowers you to have a more informed, proactive conversation with your healthcare provider and take decisive steps towards truly vibrant health. If this video opened your eyes to a new dimension of diabetes management, please like it right now to help us reach more people who desperately need this crucial information. Every like helps. Subscribe for more deep dives into health truths that empower you to take control of your well-being. Don't miss out on future insights. And please, share this video with anyone managing diabetes, especially if they're on metformin. It could profoundly change their life and help them understand symptoms they thought were inevitable. Finally, comment below. Which of these symptoms resonated with you the most? Have you experienced any of these deficiencies? What other health topics would you like us to explore in future videos? Your feedback guides our content. Remember, knowledge is power. Your health is your greatest wealth. See you in the next video.